Good morning, good afternoon. We're going to let you guys load in and then we'll start in just a couple of minutes. Welcome to our ISPA Product Pros Chat. Great, so we're going to go ahead and get started. So hello and welcome to the first edition of the ISPA Chats with Product Pros series. We are so glad that you're here with us today as we explore innovative new products, adaptations, and reopening ideas from ISPA's resource partner community. You guys have asked for this type of forum and we're so happy to be able to facilitate this for you today with our fantastic panelists. They are a wonderful group. I know them all. I want to say congratulations to Michael on his engagement this past weekend. There'll always be fireworks for you, Michael, so congratulations on that. So before we start the conversation, we're going to take care of a few housekeeping items as we always do in this forum. So first of all, we've all been on a million Zoom calls, so please mute yourself so we can hear the great advice from our panelists. Also, make sure to use your chat feature on your computer so we can have your questions filtered in along with our friends from Facebook Live so we can have a robust dialogue and discussion today. Also, we do record today's session in case you need to pick up some information or you have a friend who couldn't make it today. And finally, you will see that we have a variety of resource partners today for different opinions, different ideas, different thoughts about today's business. And we do that on purpose so you can have choices to make that fit your business, your state, your jurisdiction. So I'm very happy to get started today. And I'm going to have the panelists, as they answer our first question, introduce themselves. So I'm going to start with you, Jessica. Hello, Jessica. And my question for all of you is, can you please introduce yourself and the companies that you represent and identify the products that you have relating to PPE and sanitation. So Jessica, I'm going to hand it over to you first.
Hello, everyone. My name is Jessica Wadley. I'm the Vice President of Integrative Health and Wellness for Oakworks. We are 50% a medical and healthcare company manufacturing tables in the healthcare space, but then also 50% of our business is in wellness overall and spa as well. Beautiful tables, for example, in our background. Many of you have Oakworks tables. But specifically for COVID, we have manufactured a suite of accessories that are medical grade, that work towards protection, even really PPP for equipment, if you will, and that aid you with your sanitization protocols within the spa.
I think we all saw your table protector covers video that you did on Facebook, which was fantastic. So thank you.
Thank you.
Amir, same question for you.
Thanks, Patrick, and glad to be here with ISPA today and all of you. So Zeal has been around since 2012. We've been providing on-demand wellness, both on location and through digital wellness. A number of our clients, including the Four Seasons, Comcast, Hulu, Marriott, our enterprise partners now extend to about 1,000 clients nationwide. And so from that need, we saw that there was a challenge around procurement of PPE products, quality control, supply chain management. My own background, having gone to medical school, master's in public health and applied physiology, and was formerly leading up procurement for the state of California for the federally qualified health centers. I've spent time with manufacturers abroad and domestically and handle both the laboratory and non-laboratory testing of products, allowed us to be able to source supplies such as masks, face shields and eyewear, gloves, and of course, sanitizer, whether that be hand sanitizer or wipes. And so we're working with all of our partners today to source these products and make sure they're done reliably and safely.
That's great, thank you. I'm sure we're gonna have lots of questions around what you just said, Amir, so we'll come back later to you. Michael, congratulations.
Yes, thank you so much, Patrick. I appreciate that. My name is Michael Pugliese. I'm the CEO and owner of Circadia. We are a professional skincare brand. We supply skincare products, both professional treatment products and retail, all over the country, all over the world. We are a manufacturer of cosmetic products, so even though we do our own distribution, we're also making everything in-house. We're FDA registered, ISO certified, so that allows us to make OTC drugs, SPFs, benzoyl peroxide, things like that. And when it comes to the PPE that we've been working on, we kept it pretty simple. We went with hand sanitizer. It's something that was in huge demand early on when COVID started to hit. So we were making it not only under our brand, but for those that had a huge shortage of, for the frontline workers, everybody that needed it. So we're still doing that. We've kind of shifted our focus to make sure that our spa partners have it available because of all the new regulations that have been put into play, and making it available for them really as reopening order packages. The supply chain has opened up a little bit more, and I'm sure we'll get to the challenges as part of the questions. But that's really has been our main focus, is making sure that we have sanitizer available previously for those that need it, and now especially for our customers that want to make sure that they have access to the type of sanitizer that is necessary for this environment.
I think that's great too, because particularly in the spa environment, we don't want to necessarily put out a retail branded hand sanitizer on a sink or on a treatment room. So I think what you're doing there, Michael, is fantastic. Chad, my new friend Chad, please introduce yourself and your company and what you're doing a lot in the PPE and sanitation world. So I think you have a great deal to share with us today. Thank you.
Absolutely. Thank you very much for inviting me and letting me be a part of it. CFE Services is a full service sanitation and hygiene supply company. So we do represent many of the items that the other panelists have mentioned: EPA wipes, masks, hand sanitizers. We started about 3 weeks in when COVID hit, kind of polling our fitness equipment customers, such as colleges, large health club chains, and asking them, what are you guys going to do? We ended up just becoming a portal of good information. There's no perfect plan, but the best operators were beginning to plan. And we were honored to have a publication put into the IRSA journal, which was how to reopen, and it started addressing things like masks. So we have basically outfitted our site and our company with items in addition to EvaClean Pure Tabs, UV box style sanitation devices, air filtration, and touchless infrared temperature readers. We supply college markets across the nation with those kinds of products, and basically trying to take those now and offer them to our key spa clients, because as we have already heard, supply chains have been an issue and they are softening, but we anticipate they're going to be again.
That's great. And I think if you could give some clarity around, do we use UV wands in our spas, in our facilities? Are they effective as we need them to be in terms of sanitation and disinfecting? How do we handle textile fabrics? Those types of questions. If you could address that as we continue to talk, that would be fantastic. So I'll come back to you. Thank you, Chad. And Paul, I think I've known you the longest out of everyone on the call, probably years.
2007.
Yes, so I'm aging you and me. So please introduce yourself and your company to us.
Great, Patrick, thank you so much. And ISPA, appreciate the opportunity. So my name is Paul Wright. I serve as the Senior Vice President for Ready Care Industries. This is my 15th year. Prior to becoming a part of Ready Care, I was a spa director myself. So I'm kind of relating to what's going on in terms of behind the scenes as a spa director as you reopen. When COVID-19 hit, we kind of utilized our assets at Ready Care, which was already making bulk liquids. We're a manufacturer and a distributor of bulk liquids, including antibacterial hand soap, lotions, moisturizers, shampoos, etc. We had partnered with Germex for many years. They were great partners, but they kind of broke away from distribution and went directly to medical and hospital. So ReadyCare was wise with our owner, Gary Roby, and developing our own hand sanitizer. It is FDA approved. It's an 80% ethyl alcohol. It is safe, yet it's effective. It's, you know, nothing to boast about with its floral, but it is a very effective product. So we worked in outside of the hospitality. When hospitality shut down, we got into hospitals, nursing homes, universities, municipalities, fire departments, police departments. It was really our bread and butter until the hospitality started opening up. And right before Memorial Day weekend, we were real excited to see a few hotels open up and deliver our hand sanitizer. So we've been very fortunate. We've been diligent. And again, it's an honor to be here. And I look forward to your questions.
Thank you, Paul. Thank you all for being here. We very much appreciate your wisdom. I want to come back to you, Chad, on this first question where we're talking about the challenges that spas are facing in acquiring quality PPE and sanitation. I know there's, we're making news now in some sectors about making sure we get properly leveled alcohol on our hand sanitizers, et cetera. But what are you seeing in terms of challenges that face spas that are they're trying to acquire the proper quality PPE for their businesses?
Well, speaking to other industries that were really open and wanting to buy those kinds of products prior to hospitality and spa, having even a roadmap to open up, we would get phone calls on a daily basis wanting to buy our stock and flip it. Companies like FedEx and Macy's wanting to buy, you know, container loads of product. Sure, that kept us open, but what we began to notice is once spa began to see a path, and we had a nice Zoom meeting, Patrick, just kind of comparing notes, is saying it's time, if we're going to honor that industry, it's time to start allocating that product and not doing that. And then just watching a lot of companies come into the hygiene arena after COVID instead of before COVID. And for us, it's been a focus. It's a sister company of our fitness equipment side, but really listening to what a lot of research colleges were doing. They had a lot of time, and we've been surgically attached to our good friends at Stanford as they develop their reopen plan, and just trying to share that information with folks. And as the supply channel, as Michael mentioned, it is softening a little bit, especially with masks and hand sanitizer. But with most states going to mandatory masks, we fully expect some shortage because the same wonderful substrate that masks are made of is what wipes are made of. So it's either being made overseas, or we're blessed. We're going to have some North America made wipes that are EPA N that begin rolling out next week in large container quantities, and won't have to depend on the shipping issues that have been happening with China. We actually had a container full of our EverClean tabs and guns rotating around the dock for about 3 weeks. So we told folks they landed, but they literally could not get to the dock. And so helping clients understand that's a reality when you're working with your vendor of choice. They are trying. It's just there are so many unknowns, even with the freight side of things, to land product.
That's great. That's great. And so if I'm looking at opening my spa and I'm looking at what do I need in terms of sanitation, beyond masks and wipes and hand sanitizers, we're looking at air filtration systems. The guns that sort of spray the mist, are those effective, do you think, within this context of spa, that particular one?
Yeah. We are. In fact, we're trying to set up an environment, right? Most folks have had a custodial staff, and it's making sure there's a difference between cleaning and sanitizing. They're two completely different things. So a lot of custodial staff was kind of using their old cleaners and kind of trying to call them sanitizers. Systems like the EverClean, they're pH neutral, so they come behind, they're food safe, they're used in daycare facilities and nursing homes. Companies like Delta, Marriott, Hilton have them as their exclusive supplier. The nice thing is it can be sprayed in the presence of people. You mentioned addressing UV a little bit. We have had a team along with some registered nurses really vetting out that UV field. It has a place, but it's very challenging to get all surfaces because simply UV has to touch everything that it's going to sanitize. And in order to do that effectively, we've noticed you've got to have maps, literal maps and time for that to sit. That industry obviously launched out of the hospital industry, and those things require folks to be out of that room for up to 6 to 8 hours. So the UV products that we are highlighting, we feel are ones that can basically sanitize inanimate objects. So we're talking about a box where at a spa, if you're handing out a wipe for someone to sanitize their phone and their keys, you can imagine what that's doing to those phones and keys. So this UV box that we have the exclusive rights to has actually been vetted by Apple so that you can put your iPad, your keys, and get a 6-log kill in about 30 seconds, touchless, pick your keys up, and then the guest is able to walk away.
That's great. That's great. Thank you for that. Michael, I want to come to you on the same question because I know from a product side, you're developing lots of products that help address this. So how are you helping spas address the challenge of getting quality PPE and products into their spas to sanitize their facilities?
Sure. So, I mean, from the hand sanitizer perspective, I mean, this is such a deep topic. I mean, it seems like it's very simple, but when COVID hit, the FDA basically fast-tracked what's called a drug listing for companies like ourselves and so many others to be able to make hand sanitizer. That's why you had not just cosmetic manufacturers, but companies that were literally the week before making concrete and silly putty now making hand sanitizer. So you're able to do that. For us, companies that already buy ingredients that are for the cosmetic industry, what we saw is an extreme shortage of packaging. So we jumped on this pretty quickly, and we were able to get the drug listing in a matter of a few days, which usually takes months. But then getting the supply of packaging was a major issue. Then being able to get the appropriate types of alcohol. And we're talking about ethanol formulations versus isopropyl formulations. Those are the two that were fast-tracked by the FDA. These are World Health Organization formulas. And as Paul said, these aren't aesthetically pleasing formulas. There's no thickeners. It's basically 4 ingredients. You've got alcohol, water, hydrogen peroxide, and some glycerin in there for aesthetic feel, which is still not great. So making sure that you have the right type of alcohol. So there's USP grade versus tech grade, making sure you've got the supply of that. And then making sure that you're actually getting the right type, making sure there's a huge difference in price as well. And what I saw almost immediately was almost a doubling of cost of the alcohol. So the price went through the roof. So we actually took a step back and said, this might not be sustainable. There's only so much allocation of these raw materials, and the big guys that purchase this regularly, they're going to get their hands on it first. So we're probably not going to be able to sustain this at this price because, most people were starting to give it away, and you're only going to be able to charge so much for hand sanitizer. So again, we've pivoted towards let's make sure that we have this available for our spa partners rather than try to do a mass production. So all that to say, I think that the biggest challenge for sourcing is making sure that you've got the right type of material, making sure that it's made in a place that does this regularly so that it's formulated properly. And those are probably the 2 biggest things. And you can see that with the certificate of analysis, making sure that you've got a quality type and the percentage, making sure that it is actually, at the very least, if it's a new manufacturer who's just doing this now since COVID started, that they are using the WHO guidelines. And that's right on the FDA's website. If it was
so when you say Michael, when you say the WHO guidelines, you're talking about the World Health Organization's guidelines in terms of what to look for?
Yeah, World Health Organizations, and you can go right to the FDA's website and see, okay, these are the 2 formulations that are basically, it's either 80% ethanol or 75% isopropyl alcohol. And you'll see it as low as 62%, which, is good. But at the same token, you can't go higher than that because you still need water as a carrier in order for it to be able to kill the microbes like the viruses. So, there is still a lot of misinformation out there, but you can at least see what the recommendations are. Politics aside, no matter what you feel about an organization, this one or that, we definitely know that at those percentages, ethanol versus isopropyl, they are going to kill the microbes the way that we need them to. But sourcing actually has become a big problem. Like I said, it really jacked the cost up because the demand went up so significantly. And the scarcity caused all of that, both with packaging and raw material.
So if I'm a spa director opening a spa, I can trust coming to you or going to Chad or Paul that what you're delivering has met the WHO, the FDA requirements to keep the spa clean and sanitized as we promise that we will do.
Yes, I would.
And sanitizer.
I would. Present company, absolutely. I would say you could trust these spaces. Of course you can. But yeah, you want to make sure that you're looking at the percentage that's there. The product should also have a drug listing. I mean, the companies, some I've seen, you can go and purchase it at, you know, a hardware store, and you may not find a drug listing. But even if it was fast tracked, a company should have already applied for their drug listing and should have it. And that's relatively easy to find out, even if they got it in a matter of a couple of days. If it's prior to COVID, that usually takes several months, and it can be as low as 60, sometimes 65%. But to be on the safe side, most of these formulas are probably going to be around 70, 75% isopropyl, upwards of 80% ethanol.
That's great. Thank you so much. Jessica, I'm going to come to you because you have a different perspective on the challenges that we're facing from a PPE side. I love the sheets. I think that coverage is fantastic, but I know you're doing more than that. So can you speak to that?
Certainly. The important thing to point out is that because we are a medical company, a healthcare company, our tables are FDA listed in the healthcare space. So when we did manufacture these accessories for the spa space, we were able to leverage that supply chain, mainly because we manufacture upwards of 250 tables a day, for example. We were able to make that very accessible for the spa space, despite whatever brand that you had. So there was almost 3 layers to this. Some spas had tables that were aging and that were cracked, and they did not have the capital expenditure to purchase new tables. So that was a layer of assistance, was manufacturing these accessories, covers for tables, for stools, things of that nature, face cushions that could fit all brands. The second piece to that was we had several new builds that were opening, and we had to completely remanufacture some of the things like the heating elements, making sure that they were covered in that ISO medical grade fabric. New innovations there, less cracks for cleaning, less seams, things of that nature that are all adopted in the hospital and healthcare space today. And then the third piece was was some people had things like heating pads or other layers of padding, and their equipment was in perfect working order, but how did they create a hygienic barrier for that so that they can quickly disinfect them in between guests? So it was such an important topic, mainly because, you know, we also are concerned with sustainability, and we're concerned with longevity, and how did we preserve both, you know, the human health aspect, the planetary health aspect, and add the layer of medical protection with that. So I think the most important thing, you know, to really take away is making sure that it is an ISO 10993 medical grade. Why is that? Because mainly, even though we've got lots of phenomenal manufacturers that have disinfectants, we want to make sure that those disinfectants are not harsh and eroding away your materials even further when you're disinfecting, to make sure that you preserve that equipment in good working order and you don't have more gaps for spreading infection.
That's great. That's great. Thank you, Jessica. I'm going to come to you next, Amir, and then I'll come to you, Paul, with the same question. I know, Amir, you are procuring PPE and managing PPE for several different companies and spas. So I know you have a unique perspective on the challenges that they're facing in terms of securing what's right for them and what's a quality product. So can you speak to that?
Yeah, I think it's important to recognize that we're in an environment today where prior to the pandemic, north of 50% of PPE supplies were being produced out of China and internationally. And now we've seen triple, quadruple production happening across the world. And meanwhile, we've got, you know, investigative agencies that they themselves, you know, are challenged in terms of never really having to evaluate PPE supplies in a scale sort of way, as well as, you know, many of them never even having been into a PPE manufacturer. to evaluate products. At the same time, we've got partners on the SPA side and or companies who are being asked to turn into procurement experts overnight, in particular around PPE. And it's kind of a challenging recipe, as you can imagine. And so something that we've been really encouraging our partners on the SPA side and elsewhere is to really think about, how do you use your strengths and how do you partner with folks who can leverage their strengths in the PPE space. We can't expect our team members to become PPE experts overnight, but we can expect them to use kind of practical knowledge of identifying partners that have a track record of procuring product, of managing supply chains and oversight of quality control. And so I think that's why I'm glad to be a part of the group here today, because you obviously have a group of experts here that have actually transacted in the PPE space and can show evidence of that. Something that we overlook during a time where there's a lot of PPE brokers who have entered the space overnight and are presenting all sorts of products where standards and specifications are not really where they need to be for the type of partners that we all work with. And so I would really encourage those who are watching today to identify partners that have this track record and ask the questions that are necessary to be certain that you have a track record of success, both in terms of identifying products and services, as well as delivering those products and services. Because as supply chains are challenged, you are seeing product being held at the ports. Something that we've done at Zeal is, in addition to myself, we've partnered with former Assistant Secretary of Commerce, Michael Pugliese, from the Obama administration, from a White House counsel who was overseeing international trade. And the reason for that is because in addition to some of the domestic manufacturing partners that we work with, we also are able to source quality product internationally to really make sure our partners are getting great prices and quality products. But you have to ensure that those products can actually get where they need to go. And so so the support of former Assistant Secretary along with the expertise of our team is useful on that front.
That's great. That's great. I'm going to come, thank you for that, Amir. I'm going to come to you, Paul, with the same question about the challenges that you're seeing. I know you deal with almost probably one of the main suppliers for every spa, at least in this hemisphere. And so you must have a unique perspective on the challenges that you're seeing in terms of PPE and how to procure it and what's right for the business.
Sure. There's two key words on the challenges. One is budget, how much money they could spend. A lot of the spa directors I've been speaking to are just getting back to work and opening, given 2 days to really open their spa and looking at their current inventory they had previously before it closed, realizing what they have and didn't have and what they can spend. So with ReadyCare, we're very conscious of that budget sensitive situation. At the same time, we're concerned about the supply chain. So we have to balance both of what we can bring in and supply our customers. Specifically with our mask and our gloves, we really have to manage that because as Michael had alluded to and others, everybody's in on this game. Everybody wants to kind of get a piece of the pie. And I echo what was just said. Go with your trusted supplier. Go with those who have been in the business for over 20, 25 years, 30 years, who know what they're doing. To Michael's point, I want to go back to this hand sanitizer because, people who have made window cleaners to rum have gotten into this business and really have gone under the radar of FDA. There are two acronym agencies that we need to talk about. CDC does require hand sanitizer to be at 60%, whereas FDA says your temporary monogram needs to be 75% if it's isopropyl alcohol or 80% ethyl alcohol. Yet those two agencies seems like they don't connect. So there's a lot of misinformation and confusion out there. So I think it's also important as we have challenges with our spa directors is the education part. So I think that coming to our customers and really educating them on hand sanitizer, and more important is the other acronym, EPA. So you have to have an EPA registered number on all of your EPA registered products, including the disinfectants and also your hand sanitizer. So those have to be checked. So I encourage every customer, every spa director in management to make sure you're buying an EPA registered product. And usually it's for that facility that's being manufactured. It's also important that they understand what disinfecting is. Really, before you even disinfect, you need to clean. So the surfaces have to be clean before you even disinfect. So there's a process to that. So cleaning and disinfecting together equals sanitation. That's the definition of sanitation. So you really have to know both of those. And I think it's just important that they get a little educated on the type of product that they're using. We actually use Spa-Side. It's a barbicide product. It's a concentrate. You can get, 1 ounce per gallon ratio. We'll give you 512 of these. Yet it kills the virus. So if you're going to purchase, back to the education, a disinfectant, you need to look at the label. You need to make sure that it has a kill factor on corona human virus. And usually those are printed on the back because some don't do it. There are still some Lysol products out there that don't label it correctly. And there's still a lot more to be understood about the human coronavirus. So there's a lot of labs that having had COVID-19 samples to really test on its kill factor. And then lastly, the important on disinfecting is the dwell time or the kill factor. How long that product needs to be on a surface before it really effectively kills the virus. And you've got all kinds of different surface types. You got non-porous, you got porous, you got things that the virus stays on a lot longer. Just to give you an example, the mask itself, the virus can stay on the mask for up to 7 days. So it's got more of that material. So really the education to me is important. The budget is also the challenge. And really that supply chain, making sure that those products that we're bringing in, disinfectant, mask, gloves, hand sanitizer, are all equally balanced. And working with our supply chain has been real critical during this surge of reopening.
So what I'm hearing all of you say, I'm trying to synthesize it a little bit because it's pretty heady what we're talking about, is that it's really important for the directors or the directors of engineering, or if you don't have that, for you, the owner, to really educate yourself in terms of what is going to be effective for your business. And using websites like CDC or WHO or EPA can be a guide for that. And then I also hear you saying that it's really important that you have trusted vendors and resource partners who you're working with who can help guide that decision that you're making. Am I correct? A thumbs up or a head nod would be really great, going in the right direction. That's good. I also feel like what all of you have mentioned also is supply chain. And I think as we are seeing cases increase, that this supply chain may become an issue as the demand for more products is going to increase. So I think there's having an awareness about time factors in terms of products arriving from when they're ordered, and having enough are going to be key for people who are running their businesses to look at. And I want to say here that as an industry, I want to thank our resource partners who have really pivoted on a dime to accommodate the new reality of our business. I'm getting a question, and about the difference. I'm gonna have to read the question to make sure I pronounce the word right, if I can make my computer work. The difference between, and I'll come to you on this, Michael, the difference between benzalkonium chloride versus alcohol in hand sanitizers. Does that resonate for you?
Yeah, so that's another form of sanitizer. We're not using it in anything. That's something it's been around for a long time. I actually don't know anybody in our space that's currently using that as a hand sanitizer. And I see that it's Diane who's asking the question, and she and I talked about this probably going on 2 months ago. But it is interesting. There are a few things that are out there that do have that will work. One of the reasons why alcohol works so well is because it kills so quickly. And Paul mentioned dwell time. I mean, the dwell time for a lot of these sanitizers is, as little as 3 to 5 minutes, but some of them are 10 minutes. And they actually have to, once the surfaces are clean, you spray them on and they have to dry. So, and I'm seeing some of the other comments. I mean, it's going to add 10, sometimes 15 minutes to how long that material has to sit. So yes, we're talking about adding an extra COVID fee, or you just build that in because it's time. The time is money. So these are all things that we actually have to consider. So using something that could potentially be a little bit more eco-friendly, but I know that some of the alternatives to alcohol take a lot longer. Alcohol is supposed to work within about 15 seconds as a hand sanitizer, but the dwell time on some of the other things is much, much longer. Even something like Lysol usually takes about 10 minutes. I mean, these are all things that I certainly didn't know before COVID. So we're all kind of getting an education at the same time too. We expect these things to work instantly, but they don't.
And to your point, I think that's why, and I think we made a business decision in many spas to increase the turnaround time between treatments. And I think as we are presenting that to ownership groups who may say, decrease the turnaround time, book more treatments. I think when we're talking about the dwell rate, as you mentioned, Paul, as you mentioned, Michael, I think those are reasons why we are adding time and why we suggest in the ISPA toolkit that you do add time between treatments to allow that product to sit and dwell and actually be effective in the operation. Thank you for that, Michael. I want to come to you, Chad, because we're getting questions on the feed about porous material. How do we sanitize that? If you have any wisdom you could share in that particular, for that particular question, that would be great. Thank you.
Well, the CDC typically is not going to offer any guidance on anything that's porous. They're just going to rate on a hard surface. I will say that we have noticed many clients, in fact, Marriott has a commercial, they're using the Protexis gun and they're cleaning drapes and they're throwing it on the carpet. It has been used successfully that way, but you're not going to have a way to measure that. You have a lot of facilities pulling carpet out, pulling porous materials out. A lot of gyms, you're not going to see carpet in most of the major gyms once they get their feet under them for that very reason. I will say that in the religious space, the Pure Tabs with an atomizing sprayer has been used extensively, and it usually is color fast. We suggest that's what you're going to have to check. Is it color fast? 90% of the time it is. It is hydrochlorous acid, which is the friendly acid, as opposed to a hydrochloride, so it's safe to be around. We actually use it in our house. We had some guests come over that are family and trying to get the inner circle a little bigger, but once they came over and left, we went and sprayed our entire house with it.
Thank you for that. I'm unmuting myself. Amir, coming to you on the same question about porous surfaces, how are you addressing that with the clients that you consult for?
Yeah, I mean, I think it touches on a number of things that have already been said. I mean, Chad described some of the changes that a number of facilities are making. I think this also goes back to working with trusted partners who understand the space you're working in and have actually worked in the environments that we're talking about today. Because again, a lot of people are turning to PPE brokers or others who are selling product who have no idea what the operation looks like in a spa, hotel, or any other type of client that might be relevant today. And so really working with a partner that can identify what's going on in your setting, what are the surfaces that need to be dealt with, and how they can optimize around the product lines. I'd love to add, I think we all here are talking about these subject matters, but also recognizing that this can be quite overwhelming, right? I come from a scientific background. I'm a published researcher. I have a background in public health. I've done this on large scale. I'm overwhelmed. And so I can imagine many of the folks listening today are trying to take in as much information as possible. But I want to encourage folks to lean on their partners, lean on the skill sets that they have, which is great project management, the ability to vet partners and understand, ask the tough questions, to be sure that they have the right partners. At Zeal, we're sort of taking two philosophical approaches. One is that we know that in the early days, there's going to be a lot of learning. We need to learn together, right? People are getting back to work. The first number of weeks and months, we're all going to be learning a ton. Anybody who tells you they have it all figured out is probably not telling the truth. And so we need to get you into an environment, make sure you're resourced properly for that environment. And I would argue that in the early stages is not really when you want to over optimize, right? Your workforce is going back into a space where you want them to feel comfortable utilizing whatever resources are available to them and not having to second guess whether they should use that wipe or use that hand sanitizer with a few extra pumps, but instead feel very comfortable in their setting and are resourced appropriately. I realize that relates to budget, which is why you can work with great partners to identify cost-efficient resources to be available in those early days. The second part to this is that we realize that a lot of the folks listening in today are going to be differentiating in the marketplace with their customers and with their workforce with safety and sanitization, right? In the past, this is something that used to be in the background, in the backdrop. Now you want it in the foreground. And so making sure that during this second phase that I'm referring to, that it really stands out that you are a facility that is emphasizing safety, that is going out of your way to resource effectively for your staff as well as for your customers is really critical. And so I think these are the things on a practical basis beyond some of the words that have been used today, some of the descriptions, some of the science that can emphasize to the audience that's important.
What is your thought? I see, and I wish I could talk to you directly, Irina, about your question. She's asked a question about reusing disposable masks. That is not a practice that the company I work for is currently doing. We throw them away. But can you talk to that? Because there may be someone out there who's looking to do that, Amir. Yeah,
but there have been some guidelines provided for sanitizing N95 masks. Generally speaking, though, we recommend that disposable masks be disposed. At the end of the day, 3-ply or KN95 or N95 have a certain use period. And generally speaking, for example, a KN95 or N95 is meant for an 8-hour continuous period. The reason for that, without getting too much into the weeds, is that, these masks or respirators, as they're referred to, are filtering out any of the particles or any of the virus that might be exposed to those who are wearing them. And so you want to use the masks as they're meant to be used. Now, there are some cases where folks are using these masks in a 20-minute, 10-minute period. Depending on the environment they're in, that may mean that they can reuse them. I don't want to go overboard. At the same time, in the environment we're in right now, generally speaking, especially when you're having a sustained human interaction, you don't want to be reusing that mask again. And we've also seen questions come up around fabric masks versus respirators and how effective one is versus the other. We have to remember that fabric masks, although they may be aesthetically appealing, they're really meant to protect the environment around you, not necessarily give you that two-way protection that the respirators are providing with the materials, the filtration materials that are included in them. And so, we really do want to make things cost-effective so people can dispose of the masks once they're used and use the appropriate mask types to protect themselves as well. I'm speaking specifically about masks. Obviously, we've spoken to folks around face shields as well. There's a great deal of disposable face shields. Questions have come up about whether those can be sanitized and reused. The biggest point that we've made to a lot of our SPAR partners is let's avoid sharing between individuals. This is extra risk, extra exposure. Let's also remember that anytime you enter, sort of human dependency on compliance around these processes, whether it be cleaning or sanitizing, you're entering risk into the system. So we would rather encourage you to get, budget fit products that you can dispose of and de-risk an environment that would be dependent on more human compliance.
That's great. Paul, I'm going to come to you because I know you are in this space quite a bit as well, and masks are a hot topic on the feed here. Can you share some thoughts around reusable masks, face shields, how to sanitize them?
Well, there's two issues. One is cost, because a reusable mask is more expensive, but in the long run, it's less expensive. The question that has been brought up is how often can it be re-cleaned or disinfected to continue reusing? And that number is all over the place. 2 weeks, 1 month, one really doesn't know. So I lean to what Amir was saying is disposable. I mean, and that again is another question. How often should you use a reusable disposable mask? You know, when it gets dirty, when the string breaks, because remember I said earlier that virus can last up to 7 days on a mask. The disposable masks are intended to be disposable. And I don't really have the professional answer to tell you how often that should be thrown out. It really is going to depend upon the user itself, whether it's a staff employee or the guest using it themselves in there. The mask is really, as we all know, is to protect, you know, others, so that if you have a cough or a sneeze, you're not spreading it out through the vaporization. So I lean more toward the disposable mask. It's safer, it's cleaner. I think that guests seeing a mask, I'll give you an example. I play racquetball with a bunch of guys on the weekends, and there's a guy that plays with an N95 mask, which is not very smart because you really can't breathe in those masks anyway. And it looks pretty dirty. He says he cleans it and disinfectants. Everyone else who is in the gym wears the disposable. And I think that's what we're accustomed to. And I think that it might be more expensive with the disposable as opposed to the reusable. But in the long run, what we're trying to do is get the effect of a safe environment. So I would just lean toward the disposable.
That's great. Thank you, Paul.
Mm-hmm.
Jessica, I want to talk to you. I think one thing that we're seeing is there are lots of misconceptions about what PPE is, what we should use. Can you talk to the misconceptions that you're having to educate your spa partners on in their businesses?
Was that to me, Patrick? Oh, it was, okay. You're cut out in the beginning. There's a lot of misconception. I'm hearing a lot of focus on porous surfaces, hard surfaces, and that is an important topic. But the most important topic is really aerosols versus droplets and managing that within a treatment room. And the reality is the CDC guidelines say social distancing and we should all be 6 feet apart from each other. But that is tough to do inside of a confined treatment room when you are performing treatments. And so that's the number one misconception that we see. And there's a lot of equipment manufacturers that are recommending various things, such as shields that affix to equipment, shields that go around the equipment, and they're, you know, using language like total client protection. We have to be careful and we have to maintain our credibility within the spa industry to make sure that we're not using that type of language, I would say. So for example, you know, the barriers that we use in the healthcare space do have a span of 6 feet. Now that works for aesthetic treatments when you're working one-on-one or when you're staying stagnant behind a treatment room table, but it doesn't necessarily work as a massage therapist when you're having to move around the table. And then there's various challenges with that, the ergonomics, maneuvering that in the treatment, how quiet do we keep those things? So, you know, whatever your philosophy is as a spa director is going to become your own. You're going to have different budget abilities that you can and can't meet. Perhaps some of these barriers are things that you want to create a sense of peace of mind for the client. I think that is going to be your philosophy, but really it's all about the multi-layer approach and the CDC guidelines and sticking to those CDC guidelines. And it's funny because we all are talking about CDC guidelines, but you know, Michael and I were just at an event in California. A lot of directors and therapists and things of that nature still are not following or understand the CDC guidelines. So we need to keep talking about it. We need to keep referencing that as the source of that we all govern ourselves by. And within that, then I think if, and I'm like all of you, and the manufacturers are all like you, and we're all like all the spa directors, we want to be open for business. It's critical. But in order to do that in a confined treatment room where, you know, again, the WHO right now, as we are live, is having a live session about COVID and how it is transferred in the air through aerosols. 200 physicians wrote an email today, wrote letters to, and that we work with, about the WHO really emphasizing the transfer of COVID through aerosols. So masks and face shields, great option. Some of these, foggers that we have that are helping target some of the porous, very important. Having medical grade fabric that prevents erosion, very important. Barriers could be an important option. I think you're going to see masks doubled with face shields as being the best, so you can maneuver around the table. If you're going to have barriers, the reality is those shields, those equipment shields, need to be non-porous themselves. They need to be medical grade themselves, and they need to be able to provide a barrier that provides that 6 feet, not just small. I mean, it's kind of common sense. You have to look at it. You have to have that large 6 feet. So those are just some of the common things that we really see. But the good news is there is solutions. We've all got great manufacturers, thinking about your purchases, your OS&E budget, your capital expenditure budget, and thinking about those things that are credible and long-term and maybe not necessary. I've seen, lots of things being manufactured that are covers for things, but they're still more expensive than actually buying the accessory themselves. So we're here to help. We can consult with you. It is confusing. I know that's all been our full-time roles, is doing that, and that's what our jobs really have become.
I think I see the question about consulting has come up, and it's good that you guys are available to do that. Chad, I want to come to you on the same question about the misconceptions. I think Jessica touched on the whole concept of the aerosols and how to address that and to have that barrier. But can you also speak to the misconceptions that you're seeing as you deal with fitness centers and spa directors and fitness directors, that we can help sort of guide them in a different direction?
Sure. No, I'd be happy to. I think it was probably about 12 weeks ago when they first had a light that some of the large club chains could start opening in certain states, and sneeze guards between cardio units became the fave. Watching the college world, because they don't look at it as something that's monetary. They want to look at it as safety first. And so I'll offer both views and everybody can kind of balance it, right? So a large club operator looks at it and says, sneeze guards are important because I cannot take inventory out. I can't bring the guests in. What we've noticed though with colleges is they are abiding by that rule and they are taking cardio out. In Arkansas, it's actually 12 feet. So it's just making sure and paying attention to what your local government is saying, because the CDC will say one thing, but watching all these government mandates for health club reopenings, and many of the spas have fitness centers, make sure you're paying attention to that. And one thing I would encourage too is pay attention to your air filtration. We've brought about all this information the last couple of weeks about it traveling in the air. We see facilities spending millions of dollars trying to put their UV and HVAC systems. There isn't a one size fits all, but make sure that you've got something that is recirculating the air. There are systems out there. We supply one by Eris, which is used on the NASA, got the 2017 award. It's a HEPA 1 filter, electrostatic, air pure, but it's portable and it's not super expensive. So paying attention to the different spaces and making sure that you have that air return and space is really important. You'll see a lot of the big health club chains utilizing those kinds of things.
Thank you. Paul, I know you, again, have your hands in many spas. So those misconceptions that you're seeing that we could help in a different direction?
There's a lot of them. I chose this one, and it's washing your hands. Should I use antibacterial hand soap or should I use regular hand soap? So again, following CDC guidelines, it's been put out there. It's the first thing you should be doing. There is no cure for the virus. There's no vaccine for it, but we know we can kill it with washing our hands, 20, 30 seconds. And I really don't think that we follow that to the T. I think 10 seconds are probably done. Most cases 5, according to studies. So really just having that focus. They say sing the happy birthday twice, right? That's how long you should be washing your hands. If you really want to know how well you're washing your hands, you should probably put some Hershey's chocolate syrup on your hands and try to rinse it off. That's how you well know you wash your hands. So for us, the CDC does not say antibacterial soap, although that is being requested by a lot of the spas and the health clubs. From a ready care standpoint, we definitely sell all the bulk liquids and regular hand soap too. It's a light pear scent. But it's very important that all of the facilities, the treatment rooms, the salons, the dispensary have hand soap and a hand sanitizer. And I highly recommend lotion, because after you wash your hands so many times and you use hand sanitizer, your hands do get dry and you need moisturizer. And this has also been put out by a lot of infectious disease experts, that you need to moisturize your hands after you hand sanitize them, because if you look at your hands like the Grand Canyon, a lot of the viruses can crevy in there and stay in there. So it's important that you fill it in after you wash them. So I have to say that hand sanitizing is a misconception, the fact that people really don't understand what 20 and 30 seconds is, and they have to practice it. And I think a lot of the spa directors coming back on board now are posting what you should do when you wash your hands, because it's not just washing, it's scrubbing, it's getting under the nails, it's getting in between the fingers, it's really going all the way to the mid forearm to properly wash it and to do it correctly. And to save water, you need to turn off the faucet and scrub and rinse with soap, and then turn the water back on. So I just really wanted to emphasize that, more important than anything.
That's great. That's great. Amir, your thoughts, your final thoughts. I'm going to come to Amir and then to you, Michael. We have 4 minutes left, so if we could be tight in our response, that would be much appreciated. Amir.
Sure, yeah. So I think the main thing I would want everybody to leave with here is that there are experts available to you. We are taking a very consultative approach at Zeal. We're working with partners, understanding their environments if we haven't already worked in those environments with them, and bringing best practices from a number of spas that we're working with, as well as corporations that are dealing with unique challenges themselves. And so, finding a partner that will take that consultative approach, who can work through these different areas, is really critical during this time. And thankfully, you've got some great options, and hopefully we can be of service to those who are watching today.
Thank you, Amir. And Michael, you'll have the final word on this.
So I think that it needs to be pointed out that aesthetic professionals, we're trained on sanitary practice and procedures. This is something that's part of our licensure, no matter what state we're in. This is just forcing us to take our education in this area to the next level. So I think it's important for us. We've got some great resource partners that are here. There's so many. ISPA's done an incredible job providing those resources, as have so many other organizations. But it's just up to us to be able to deliver to those massage therapists and estheticians who work in these spas of all sizes, big and small, to deliver that information. And it comes from the leadership, from our brands, from those that are managing those skincare professionals, to be able to help to provide that. They certainly want it. They're certainly looking for it. Obviously, there's some inconsistencies in the information that's out there, but I mean, everybody's in this together, and we're all trying to just figure this out. So again, thank you so much for allowing us to be all part of this, as we're working together to come together as an industry and truly figure it out.
Thank you, Michael. And so what I'm hearing today, if I can synthesize, is that we need to educate ourselves, really understand what's on the CDC website and the WHO website, deal with air circulation, make sure we're washing our hands, and be very, very diligent about changing face masks in the treatment rooms and throughout the facilities. I want to thank all 5 of you for today. I think we could have gone for another hour with these questions. I'm going to re-educate myself and do some reading myself. But thank you guys for being so generous with your time today. I want to let our people who are attending today know that we'll have another series next Tuesday, 14th at 2 p.m. Eastern. And you can register for that chat and other town halls at experienceispa.com. And thank you all again for really being great for our first panelist. We appreciate it so much. Have a great day, everyone.
Thanks, everybody.
Thanks.
All right. Thank you, Patrick. Thanks, everyone.
Thanks, Patrick.
Bye-bye.